Hello, everyone. This is a Unified Project podcast by Tyrone Grant, Waldorf University. First, I want to introduce myself. My name is Lieutenant Tyrone Grant. Work with Macon-Bibb County Fire Department, and this is today's podcast. I am a first responder, firefighter, fire officer. Been with my department for 12 years. In that time, I've been a firefighter. I've also been a fire investigator for a few years, and as well as an EMT throughout that whole time. And in today's podcast, we are the HIPAA podcast. So today we're going to talk a little bit about HIPAA. What is HIPAA, right? And through this, we're just kind of introduce it and just talk about it, because I know through our department, we've had times where text messages will get sent out with patient information and so on and so forth to the hospitals. And I know that quick way of doing it, and it works. It puts it in writing quickly for the ER, but we also have to know when we can't do things and how do we do it properly and safely, right, to protect everybody. So with that, we're going to just talk a little bit about the importance of HIPAA, right? Not only so much the importance of HIPAA, but what is HIPAA, right? So, first, what does HIPAA stand for? HIPAA. It's the Health Insurance Portability and Accountability Act, right? So, with that, we are it's there to protect the patient. In public safety, what do? We protect life. And so we want to make sure that we're protecting our patient and their rights as well. This information, we can't just put it anywhere, right? It has to be protected. All right. So who must comply to this? Who must comply? So it applies to everybody. When I say everybody, I mean employees. I'm talking about full-time, part-time, temporary, retirees, their spouses, eligible family members, trainees, volunteers, interns, vendors, and even contractors that work with our government, our department, everybody. Anywhere patient information can get moved, seen, traveled, it relates to everybody who can be around, right? And that's why it's so important to protect that, right? So what does HIPAA cover? So it protects the health information of that patient, right? So it safeguards all of the identifiable health information of a patient, right? So what, and not only that, but it protects it in electronic form, in paper form, as well as verbal. So what does that mean? Social security numbers, name, addresses, contact information, any medical records, including prescriptions. It may also include the medical billing, right? This information also includes person's physical and mental health conditions, whether it's past, present, or future. It could be the healthcare service provider of that individual, or it could be the payment or healthcare services. All right. Applies to any organization that deals with healthcare, right? So hospitals, doctors, clinics, dentists, and pharmacies. All right. This also includes all of our health plan, HMOs, our Medicare, Medicaid, anybody your employer sponsors to do these health plans, right? We're all included under this. HIPAA also expands to your third party vendors who, like I said, those contractors, right? Who work with the records and information, like the IT services, billing companies, even your internet storage partners, right? Or even if there's legal firms that have to deal with the medical, it involves them as well. So texting, and the main key, why are we talking about this? Text, right? So why is it so bad to just send that text and give it to the ER nurses, right? Well, first, we need to have permission from that patient to send their information via text, right? Like I said, we're protecting the patient. It is their responsibility, or excuse me, it's our responsibility to protect their information, right? So we have to know that it's okay with them to even send that text in the first place, right? And sometimes that can be very hard if that patient is incapacitated, right? You can't get a permission from them, right? Many texting platforms are not encrypted, leaving information vulnerable to interception by hackers, right? So, what we mean by encrypted, if it's not completely protected from getting hacked or being able to be seen by anybody else, then it's not safe to send it that way. Phones can be lost, stolen, or accessed by somebody else, right? So if your phone's stolen, or if it's lost, or if your phone's unlocked and it happens to just be on the screen, and somebody can go through your phone and they can see that patient information, that's not secured, right? And then, of course, we all love the autocorrect features when we're sending text messages, or, but sometimes when that information gets changed, right? So it could be autocorrect errors, or even if you accidentally click the wrong name when you're sending the information, you could inadvertently send it to somebody else. And now that information is you just sent it out somewhere else to somebody else, right? That's not supposed to have that information. So that's why it's so important that, you know, under this act, the HIPAA Act, we need to make sure we grant individuals their rights over their protected health information, right? And assessing their health records, requesting changes, and limiting the use of their information. It also establishes penalties for noncompliance, and that could be fines or even criminal charges depending on the severity of the violation. HIPAA requires that we cover these entities to implement these safeguards, right? So we got to implement safeguards like encryption, like we talked about, safeguarding access to the information and how the data transmission is securely sent. We also got to make sure we follow these policies and create these policies and make sure we have training like this video, this podcast that we're doing today, as well as controlling access to physical locations. Overall, we must do what we can to protect our patients. Thank y'all for listening to this short podcast about the HIPAA. And y'all have a great day. Be safe out there.